Citalopram, also known as Celexa, is a medication used to treat depression by improving energy levels and feelings of well-being. It is classified as a selective serotonin reuptake inhibitor, SSRI, and works by helping to restore the balance of serotonin in the brain. The usual starting dose of Celexa is 20 mg once a day, and it can be taken with or without food. It is recommended to take Celexa at the same time each day, and it may take several weeks for the full benefits of the medication to be felt. Your doctor may adjust your dose as needed to find the optimal dose for you. Before taking Celexa, make sure to read the medication guide and the patient information leaflet provided by your pharmacist. If you have any questions, ask your doctor or pharmacist. You can take Celexa with or without food, as directed by your doctor, usually once daily in the morning or evening. The dosage will depend on your medical condition, response to treatment, age, lab tests, and other medications you may be taking. If you are using the liquid form, be sure to measure the dose using a special measuring device/spoon and not a household spoon. To reduce your risk of side effects, your doctor may start you on a low dose and gradually increase it. Take the medication regularly at the same time each day to get the most benefit from it. Even if you start feeling better, do not stop taking Celexa without consulting your doctor. It may take 1 to 4 weeks to feel the benefits of Celexa and several weeks before experiencing the full benefit. If your condition does not improve or worsens, be sure to tell your doctor. And if you have any new or worsening symptoms, report them to your doctor right away. Common side effects of Celexa may include nausea, dry mouth, loss of appetite, tiredness, drowsiness, sweating, blurred vision, and yawning. If any of these effects persist or worsen, notify your doctor or pharmacist promptly. It's important to remember that this medication has been prescribed to you because your doctor believes that the benefits outweigh the potential risks of side effects. Many people using this medication do not experience serious side effects. However, it's important to notify your doctor right away if you experience any serious side effects, such as shaking, tremor, decreased interest in sex, changes in sexual ability, easy bleeding/bruising. In rare cases, Celexa can increase serotonin levels and cause a serious condition called serotonin syndrome/toxicity. It's important to seek medical help immediately if you develop symptoms such as fast heartbeat, hallucinations, loss of coordination, severe dizziness, severe nausea/vomiting/diarrhea, twitching muscles, unexplained fever, or unusual agitation/restlessness. Additionally, males may rarely experience a painful or prolonged erection lasting 4 or more hours while taking Celexa. If this occurs, it's important to stop using the drug and seek medical help right away to avoid permanent problems. While very serious allergic reactions to Celexa are rare, it's important to seek medical help immediately if you notice symptoms such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects not listed, it's important to contact your doctor or pharmacist. As always, it's important to discuss any concerns or questions about side effects with your doctor or pharmacist. Antidepressant medications like Celexa are used to help with conditions such as depression and other mental or mood disorders. They can also help to prevent suicidal thoughts and provide other important benefits. However, studies have shown that a small number of people, especially those younger than 25, may experience worsening depression, other mental or mood symptoms, or suicidal thoughts when taking antidepressants. It's important to talk to your doctor about the risks and benefits of taking Celexa, especially if you're younger than 25. If you notice any worsening depression, unusual behavior changes, or other mental or mood changes, such as new or worsening anxiety, panic attacks, trouble sleeping, irritability, or impulsive actions, it's essential to tell your doctor right away. This is especially important when starting a new antidepressant or changing the dose. The usual starting dose of Celexa is 20 mg once a day, and it can be taken with or without food. It's best to take it at the same time each day. Your doctor may adjust your dose based on your response to the medication. Remember to follow your doctor's instructions and never stop taking Celexa without consulting your doctor first. Before taking citalopram, let your doctor know if you have any allergies or if you are allergic to citalopram. This medication may contain inactive ingredients that can cause allergic reactions or other issues. Before using this medication, inform your doctor about your medical history, especially if you have a personal or family history of bipolar disorder, suicide attempts, liver disease, seizures, low sodium in the blood, bleeding problems, or glaucoma. Citalopram may affect the heart rhythm, causing serious symptoms that require immediate medical attention. The risk of this condition may be increased if you have certain medical conditions or are taking other drugs that may cause heart rhythm issues. Low levels of potassium or magnesium in the blood may also increase your risk. Talk to your doctor about using citalopram safely, especially if you have conditions such as severe sweating, diarrhea, or vomiting. This medication may cause drowsiness or blurred vision. Avoid alcohol or marijuana while taking citalopram, and do not drive or use machinery until you know how the medication affects you. Before having surgery, inform your doctor about all the products you are using. Older adults and children may be more sensitive to the side effects of this drug. If you are pregnant or planning pregnancy, discuss with your doctor the benefits and risks of using this medication. This drug also passes into breast milk, so consult your doctor before breastfeeding. Before taking Celexa, it's important to consider potential drug interactions that could impact its effectiveness or lead to serious side effects. Make sure to inform your doctor and pharmacist of all the medications, including over-the-counter drugs and herbal products, that you are currently taking. Some products that may interact with Celexa include other medications that can cause bleeding or bruising, such as antiplatelet drugs and NSAIDs. Additionally, taking MAO inhibitors with Celexa can lead to a serious and possibly fatal drug interaction. It's important to also be cautious when taking other products that can cause drowsiness, such as alcohol, marijuana, and certain prescription drugs, while using Celexa. Certain medications, such as those for allergies or coughs, may also contain ingredients that cause drowsiness, so be sure to check the labels and speak with your pharmacist about using them safely. Finally, it's important to note that Celexa may interfere with certain medical tests, potentially leading to false results. Be sure to inform lab personnel and all your doctors that you are taking this medication to avoid any issues with test results. If you or someone else has taken too much Celexa and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical attention. In the U.S., you can call 911 or your local poison control center at 1-800-222-1222. In Canada, you can call a provincial poison control center. It's important to not share Celexa with others, as it is prescribed specifically for you. Your doctor may also schedule lab tests, such as an EKG, to monitor your health while taking this medication. Be sure to keep all medical and lab appointments and consult your doctor for more information. If you forget to take a dose, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and take the next dose at your regular time. Do not take a double dose to make up for the missed one. It's important to store Celexa at room temperature, away from light and moisture. Be sure to keep it out of the bathroom and away from children and pets. When it comes to disposing of Celexa, it's best not to flush it down the toilet or pour it into a drain unless specifically instructed. Instead, you can properly discard the product when it's expired or no longer needed. If you're unsure about how to do this, consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.